So it's about 10:17 to 9. Hi everyone, Shinan from Center of Balance, the acupuncturist. I have two screen on tonight. So this is on my Facebook page and YouTube as well. Now we're gonna talk about frozen shoulder tonight. The topic is frozen shoulder. I'm going to talk to you what you can do at home as well, and how does what is frozen shoulder. Okay. Now, frozen shoulder, it also called adhesive capsulitis. Well, have you heard about that? Now, I don't know whether you suffer from frozen shoulder or not, and it's very awful symptoms. It probably keep you at nighttime. I personally never had frozen shoulder, but hi, Glennis, how are you? On Facebook, thank you. Now, frozen shoulder is a medical term. No one know where it came from, actually. Okay, if you have frozen shoulder, okay, the capsule around the joint has become too tight or stopping you moving your shoulder. We really don't know, or no one could tell you where it actually why it happens. Okay, so sometimes it follows from an injury. Okay, yeah, you hurt yourself and you had pain and you can't move it, and then you couldn't move it as you getting a lot of treatment, or you don't get any treatment and you taking painkiller, and it just can't move your shoulder, and you may have frozen shoulder. Okay, it could follow after an injury, or it can be from after a heart attack or a stroke. Okay, it's actually more common in people with diabetes who can't produce insulin properly. Okay, yeah. Goodness, so painful frozen shoulder, especially when it's relaxed. That's right. So you are right. Okay, so when you relax, which means a lot of cases actually couldn't sleep at night time. When they relax, they can't go to sleep. Okay, so I need to tell you, when I was in medical school, okay, when we studied there, and our professor told us that about frozen shoulder, and frozen shoulder is a very sad case for a very difficult case, and sad for practitioner and acupuncturist, any practitioner, to be honest. Why is that? Because with frozen shoulder, when this is what I heard my master say, that when you treat them, and when they can't get any better, and some patients just give up, and after 2 or 3 years they came back, everything's fine. Okay, so frozen shoulder is a type of it's a type of problem that it can heal itself over years. Okay, this is truth. But I do have to tell you, I've seen people after 3 or 4 years, even up to 10 years, they are in pain. Okay, so not everyone suffer from frozen shoulder and it would heal itself. Okay, now frozen shoulder comes with different stage. The first stage is painful. Pain is the most uncomfortable feeling. Okay, when you relax, it get more pain. Some people, they don't know. You probably don't know what is the most comfortable. What is the most comfortable position for you when you sleep? Okay, some is when they move, they start feel pain. In the beginning, most of frozen shoulder, you'll be able to move your arm, the mobility, the range of movement of your arm, no problem. It just comes with pain. It just comes with pain. Okay, goodness, my husband had diabetes and really suffered with frozen shoulder. My husband just tolerated with. We had met you. That's why we have met you then. Yeah, frozen shoulder, a lot of people with diabetes, it actually suffer from frozen shoulder. This is truth, okay? And we treat frozen shoulder in our clinic. So we help them improve the range of movement and reduce the pain, okay? And it's a very difficult one, I have to tell you, okay? But something that you can do at home that I'm going to talk about later. Let's talk about pain first, okay? You feel pain first, but it doesn't really affect your movement at first, but in some cases it come early, that pain start for a few weeks and then they can't move the shoulder, okay? And you need to understand on the second stage is you start to get pain. You have pain first, and then you start to get limitation of your movement of the shoulder. Okay, that's the second stage. Then the third stage, the pain gone, no pain at all, but you can't move your shoulder. Okay, you can't move your shoulder. This is the third stage. And the fourth stage is you start to feel, my shoulder is better now. I can move it. You know, so really, it's not as bad if you don't feel the pain and you just can't move it. So we actually recommend our patient, even when you have pain, try to move it. Okay, there are some exercise. If I have chance, I will show you some exercise in the future. And doing, even you in pain, so do some heat pack around it and do some massage and keep mobile. Keep moving your hand, okay? So get to the, if you lift up, you feel pain, you lift it up until you feel pain and you stop it there and put it down. So every day you have to do some exercise, okay? So keep your, because you know the pattern of, we all know the pattern of frozen shoulder. It can pain and pain with limitation of movement, then pain's gone and just no movements. All right. So you want to keep your shoulder as mobile as you can. Once you don't have pain, you'll be able to work as normal. All right. But I do see some patients after 10 years, they have limitation of pain or even still with some pain. Okay. So not everyone would be able to go to those stage easily, to be honest. But what I see in my clinic with my patients, if you have treatment with frozen shoulder, stage 1 is the most important stage. If you have pain, if we can quickly reduce the pain and you can keep mobile, then you don't have to go suffer from stage 2 pain with limitation of shoulder movement. Okay, so it's important to get it done quickly before it move to limitation of it stop you moving. All right, this is very important. Let's keep going. Let's see my notes. What I should, what have, where we up to? Okay, now we're gonna talk about some treatment. Okay, so for the treatment, and if you don't understand about acupuncture, so most people would do is steroid injection. I do have to tell you, it will work for the pain, but it won't work for the movement. Okay, it should work for the pain in some cases, but not every cases. Okay, it may work for few months. If you're lucky, 3 months, then the pain gradually came back. Right. So of course, people, when you have the pain, you take painkiller in general. Okay, I need to point out is painkiller is not good for your kidney and liver. Everyone know that. But when you take the painkiller or you have pain, you didn't think about it, and when your doctor give you prescription, they won't tell you, because it's so common that we have suffer from pain, we take painkiller, but you need to watch out. There are a lot of studies about this, and they actually write down on the paper. When you get this prescription, it actually tell you what the side effect is. So you need to read it. Okay, if the pain, if you'll be able to reduce the pain, get more comfortable with heat pack, I would rather recommend you do the heat pack rather than painkiller. Okay, this is my suggestion, and that's my, unless you are in such bad pain and you really need painkiller, then here you go some painkiller. But if any other things, that acupressure point, it can stop the pain or reduce the pain, or heat pack can reduce the pain, or any other TENS machine or whatever, it can reduce the pain for you and do it more. This is what I recommend for all my patients. Okay, I hope you get what I mean. Okay, so we talk about steroid injection, physiotherapies. Okay, physiotherapies, a lot of people like it, and it's good method, to be honest. It gives you some massage on the shoulder joint, and of course it show you some exercise, and those exercises are very good, and you have to keep going with that. And so most people with frozen shoulder make a full recovery. Okay, but again, if you have problem continue even after trying other treatments option like painkiller or physiotherapy or steroid injection, you may consider acupuncture. Okay, or you should consider acupuncture at the very first place, or you get the while you're doing physiotherapies, you come to acupuncturists as well, because what we can do is much more than just show you some exercise or give you some massage on the actual area of the shoulder, the pain. We can do acupressure point. We can show you how to do acupressure point again, and we can do acupuncture. So in acupuncture, we can find out which muscle is tight, and we can release the muscle on the local area. And again, we can go to the distal area to stimulate the we call qi and blood, the energy to flow to the entire body to help reduce the pain and improve the range of movement. And another thing in acupuncture, again, we're going to show you in here. Sorry for those people on YouTube. You probably will see it. You can't see it all clearly in here, but on Facebook, you'll be able to see it clearly in here, because all the word is all good. It's not opposite, but on YouTube it's opposite. So again, when it comes to frozen shoulder, we want to know your. We mentioned about diabetes, heart attack, and stroke, right? Those patients suffer from frozen shoulder easily, right? So which means they have an internal organs imbalance first. Then move forward, they suffer from frozen shoulder. In this case, we always want to look at the organs imbalance. Again, stomach and spleen control the entire body of muscles. So we want to get your stomach and spleen function better. Then the muscle of your entire body, including your shoulder strength, the muscle strength, will be better. And liver and gallbladder control tendons, joint, and nerve functioning. So this is joint. They have a lot of tendons as well. Okay, so liver and gallbladder function need to be better. They need to be improved. So your tendons and your joint will have more circulation in there and help it heal. Right? So kidney and bladder, they control bone. So between the shoulder joint, two bond together and become a joint. So the bond need to be strong. Where does it come? Where does the strength come from? It all depends on the kidney and bladder functions. So again, all this organ theory It's only in Chinese medicine. If you talk about organs, Chinese medicine organ theory to your doctor, to your physiotherapy, osteopath, chiropractor, they want to understanding. They want to understand it because that theory is only unique in Chinese medicine and acupuncture. So yeah, I know some physiotherapy they understand because they study some acupuncture as well, and but they mainly do dry needling. It's totally different. They mainly look at the muscle rather than organs itself, but they do have some idea about it a lot. And some doctor very open mind. They actually learns acupuncture as well. And I just made Gary osteopath in Cambridge, Leamington. Is from South Africa, and he loved it when I talk about share about organ theory to him, and we swapped the treatment, and because I never had osteopath treatment before, and I had a try. Wow, it was amazing. I love it, and it's just so different with Chinese massage tuina because we do manipulation as well, and it's quite different. I don't use it so much of those technique in my clinic, to be honest. And but yeah, Gary, wonderful osteopath. Okay, I do recommend you guys to go to him. He's in Cambridge in Leamington. Okay, it was wonderful, and he tried some acupuncture as well, and we swapped some treatments, and yeah, he loved it too. And so uh, hopefully we will be able to get in the clinic in Cambridge soon. Work with Gary. All right. So really, when it comes to acupuncture in Chinese medicine, we need to look at the organs. When the organs, the reason is why all practitioners look after, treat the frozen shoulder and can't get much relief, and the pain keep coming back. Even though you have relief, and you still move to the stage of limitation of frozen shoulder. So in acupuncture, we want to break this stage. We want it to be no pain, quickly reduce the pain and stop the pain, and improve the mobility of the shoulder. Okay, so we can do acupuncture. We talk about it, and we do scalp acupuncture. And one of the beautiful thing for scalp acupuncture is we need those scalp acupuncture. One, we test it out, and it helps your shoulder. And normally we would instant. Okay, when it gives you instant relief, we leave the needle there, and you bring home, and you keep exercise your shoulder. Then that will help you in a stage of releasing the pain, so reduce the pain, and you'll be able to move. Because what happened is in frozen shoulder, you want to make your shoulder more movement, right? But because of the pain, stop you moving. Then scalp acupuncture is a great method to stop the pain, reduce the pain, to reduce to a level that you'll be able to keep moving your shoulder and increase the mobility. That is one thing that I find it works very well for frozen shoulder. And of course, if we just use scalp acupuncture, that's not good enough. We need to loosen up the muscle around it. So with physio, they do dry needling. I do agree with that. Okay, some needle on the localized. Again, frozen shoulder is much harder. That's not good enough. Just doing dry needling. That is why we need to look after the organs as well. That's another one. And we want to look after the meridian as well. We know a lot of meridians, 6 meridian go up to here. So we want to help the meridian have full of blood and energy flow on the shoulder, on the meridian. So this is the idea. So once we have this idea, that's something that you can do at home. That's what I'm going to talk about for you if you suffer from frozen shoulder, apart from acupuncture and Chinese herbs. So Chinese herbs will build up the organs imbalance. Apart from that, what can you do at home? We talk about distal acupuncture to help the meridian have some more blood flow, right? And to be honest, when you do joint needling or trigger point needles on the shoulder, okay, or on your neck, those are trying to loosen up the muscle and get more blood flow as well. Because without blood flow, you have no chance to heal. We want more blood flow, okay? And funny enough is in Chinese medicine, frozen shoulder. What is frozen shoulder? The first idea for you, what is frozen? Okay, frozen is you put something in the ice on the refrigerator, and you get frozen. That is the feeling. So you put your shoulder into the refrigerator in winter and get cold. That called frozen, right? So what in Chinese medicine we call 尖周炎, which is 50肩 or 肩动. We call ice shoulder, frozen shoulder, which means it's cold. And one of the bigger reasons Chinese medicine think the cold stop you moving. Why cold stop you moving? So frozen, why frozen? The cold time and the blood flow doesn't go properly. Okay, the blood flow slow down in the joint. It hasn't got enough blood to narrow the joint, the tendons, the muscle. Right? This is something that we need to increase the blood flow and remove the cold. So what is the best way to remove the cold? Heat pack, hot water bottle, tiger balm, keep warm for your shoulder. Okay, so wear some warm clothes to cover it up. So this is very important. When you put heat on it, you feel comfortable. Put more, not just half an hour a day, as much as you can, every hour, every 2 hours. Even though you can get the heat pack and tie it up on your shoulder and wear it through the day. When it's cold, heat it up again, put it back in. This is something that you can do at home. Of course, we have video about the acupressure point, and you Google in searches, it's all on the YouTube. And or we talk about all the distal point for shoulder pain. This all work for suitable for frozen shoulder as well. Okay, I hope you get something out of this video, and I know you know how to do some maintenance treatment, reduce the pain by using heat pack at home. And this is going to help a lot, and I hope you love this video. If you're on YouTube, please like it and subscribe to my YouTube. If you're on Facebook, please share this video with your friends who suffer from frozen shoulder. And we have I'll put it on Facebook first. We have a free online consultation and pre-assessment. So you can call us on 0784679956. So sorry, you can't see it probably on YouTube, but it's actually 0784679956, and it's all in the description, all my details. So you're welcome to call us, and we'll give you assess up to 15 minutes is for free, and to let how bad is your frozen shoulder and how we can help you. And then next step is to get you fill in initial examination form, and then we can go start from there and give you a treatment plan, and to let you know how much it's going to cost you and what you can do at home for acupressure point, and what else in your diet that would help your frozen shoulder as well. There are many things to talk about. Now, if you can't help yourself, if you have suffered from frozen shoulder for years and years and years, and you still have pain, or you still have some, you can't move it, you don't have pain now, but you just can't move it, hey, acupuncture and Chinese medicine are available for you, and they are very good for frozen shoulder. And call us 078467956. I'll see you tomorrow. And I'm Sunan from Center of Balance. Stay awesome, and I love you all. Bye bye.